those people that don't necessarily have access to the tools like Tim introduced, the likes of the GPS. Actually, that kind of technology is proliferating all the way down the performance spectrum now, so you can even get hold of some of this technology now for about $300 a unit. So that's coming, and the technology will get cheaper, but equally, it's good to ask our athletes questions and speak to them and find out how they're feeling and how they're responding to the training. So I'm going to change tack slightly for my talk to talk about when we should think about injury prevention exercises. And in that talk, I'm not going to come up with these nice, clean conclusions about, yeah, you should do these exercises and you should do them at this time, because everybody's context is different. But hopefully I'm just going to present to you a series of studies that we've done at Western Sydney University over the last 4 or 5 years, where we've just been challenging the notion of when we implement injury prevention programs. And so we've been fortunate that Football New South Wales have supported this program of research, but it's also been funded by, am I going the wrong? There we go. It's also been funded by the New South Wales government on a few occasions as well. So when is the best time to prevent injury? And in that context, I'm going to talk about it in 2 different ways. One, when should we look at injury prevention in relation to the training session that you're delivering, or the match, if that's what you like to do. And then in the second half of the talk, I'm just going to introduce you to some really novel information. We don't have a lot of information about this in terms of when we might deliver injury prevention exercises during the microcycle or during the training week. So I guess to start us off, I wanted us to think about some of the factors that people think about in terms of, well, why do certain athletes get injured a lot? What are the biggest risk factors? And a guy called Alan McCall and our next presenter, Associate Professor Rob Duffield, did this study a few years ago, and they questioned about 44 what they call Premier League teams from around the globe. So sampled from the likes of the EPL, La Liga, the A-League in Australia, so on and so forth. And they asked the injury prevention specialists a variety of questions, but one of them was, what do you perceive as the most important risk factor for injury? And this table there just ranks them, and there'll be no surprise there that the number 1 risk factor was previous injury. If you've had an injury before, you're most likely to break down again if we don't rehabilitate appropriately. Or even if we do, there's still a bigger risk we can get injured. But the one I'm particularly interested in is fatigue, and fatigue ranked second in terms of those risk factors. So why do our experts, our sports medicine experts, think about fatigue? Well, this data will probably support that notion. So what we've got here is when an injury occurred during the course of a 90-minute football match. This data was taken from the English Football Association's audit of injuries back in 2001. And what you can see there is a really strong within half trend, whereby in the first 15 minutes of each half, the injury risk is comparatively low, or the injury incidence is comparatively low. Bearing in mind, in particular, the first 15 minutes of a football game, if you look at Tim's GPS data from the NPL, that will be when they cover the most total distance, the most high-speed running distance in that first 15-minute period. You'll know it yourself when the teams start to engage. In the early stages of the game, where they're feeling fresh, is when they're working the hardest. But we don't have many injuries comparatively in that phase. But in the last 15 minutes of each half, we get an increased injury incidence. Same data, same pattern. This is from youth players. Again, a study of all the academies in England. And then more recently, we had similar trend, not exactly the same, but a very, very similar pattern in Jan Ekstrand's European Champions League study on injuries. So we know that players are more likely to get injured towards the end of each half. And that made us think, why do we tend to do injury prevention either within the warm-up or before you've even gone out onto the training pitch to train? if you look at the FIFA 11 Plus, which I'm sure everyone in the room is familiar with, that's a great tool in the sense that we don't need the experts to help us deliver this. It's a useful tool for anybody at any level of football, and it wasn't designed for the A League or the W League. Those guys have got the resources. Okay, they've got the sports scientists, the strength and conditioning, the expert sports medicos. But the FIFA 11 Plus can be administered by anyone with a little bit of training, and can be done without any equipment or facilities. And so it made us wonder why did FIFA prescribe this injury prevention program at the start of a training session? Probably for compliance. You've got all the players together at the warm-up. But we asked, why would you look to do an injury prevention program that is actually quite fatiguing before you then send your players out to train? And are you then increasing their level of fatigue? But we know that the further they get into that training session or the further they get into that match, the fatigue can kick in, and we've probably got a higher risk of injury incidents. And should we be doing something to protect our players when they are fatigued? So what I've got here is just a summary of a couple of studies that we did to just looking at that question in particular. So the first two studies we did, we just looked at eccentric hamstring strength. So we know that hamstring injuries, accounts for about 16 to 20% of injuries certainly in men's football. And strength is talked about as one of the major risk factors. So, and we know that playing a football match or playing a training session, our hamstring strength reduces quite substantially over the course of that training session or whole game. And so we just picked one of the exercises from the FIFA 11 Plus. I'm sure most of you have heard of it. It's called the Nordic hamstring exercise. And we had the athletes do a number of reps, and then we tracked their eccentric hamstring function. The first study we did, we just had them do some sets, and what we found was just after one set of 5 repetitions in the Nordic hamstring exercise, there was some quite significant fatigue, up to about 30% drop off in hamstring strength immediately after one set of 5 repetitions. And in particular, in the most vulnerable joint position. So most hamstring strain injuries occur when we're at the terminal phase of the gait cycle, so we're fully extended, the muscle is in a really elongated position, and then it's having to shorten rapidly to slow down and allow us to break and continue on our stride pattern. So that is the most vulnerable position, and that's where we saw the most decrements in strength immediately after just one set of 5 Nordics. What we didn't know though is, if we carried on a training session, how long would it be before that kind of function was perhaps retained again? If we gave the athletes a little bit of rest, an interset rest, would that help? And so we had had some participants in our lab do some sets of Nordics before what we called a simulated training session. So they either came in, did a warm-up, did their Nordics, and then we did a standardized training session, so they did exactly the same sprinting, running distances, and so on and so forth. And in another session, we did a warm-up, but we left the Nordics out, and we put them right at the end. And as you might expect from what I've spoken about so far, the grey bars on this graph show us that if we put the Nordics after training, we don't see the same fatigue effect. So even after 15 minutes of football training, if you put the Nordics before, we were seeing a decrease in hamstring function. And that continued throughout our 60-minute simulated football training session, if you like. And those drops were not insignificant. We were talking 16 to 19% drop off in hamstring strength over the course of that training session. So should we be putting those exercises at the start? Another reason why you might want to think about when you schedule those exercises is how the body acutely adapts to the exercise stimulus that you've given it. And so there's lots of research out there that examines this thing called the interference effect. And what that is it looks at the order that you do your training in and how the muscle responds and adapts to that. And so, for example, it's quite commonly known that if you do endurance exercise after a strength training type of exercise, then the adaptation, the muscle's adaptation to the strength training is somewhat nullified to a certain extent. It's depressed. Okay, so in terms of the order of training, if we're to do a lot of damaging or challenging exercises before we go and play football, which is predominantly an endurance activity, we're actually then reducing or suppressing the muscle adaptation that we might get. Now there's lots of questions that the sports scientists have in terms of how long do we need to have between the strength training session and the endurance session, and we don't have all the answers to that. We also don't know over a long period of time how detrimental that is. But there was a study here done by Liverpool's academy, the older players in their academy study, and they looked at a couple of phases of training. So for one 6-week block, the players went out onto the pitch about 10:30, had a break for lunch, and then they went back into the gym maybe an hour and a half, 2 hours later. And then they did that for up until Christmas, and then after the break, they switched it around for the purposes of the research. So then they did a strength training session, protein ingestion, and then they went straight out to the field. So the strength training session was in the morning. What you can see here for both quadricep strength and hamstring strength is that the bigger training adaptations occurred when strength training was done after the field training session. Okay, so you weren't nullifying the adaptation, if you like. So that got us thinking again about FIFA 11, different injury prevention exercises. So the next question to us was, well, we know we get fatigued by doing injury prevention before we send the players out onto the pitch, but we have to do it at some point. You know, Matt's shown some data about 45, 50% drop off in injuries. That's well known around the world that the FIFA 11 Plus has got a good success rate. So as long as they do it, that's okay. And we wondered whether the adaptations to training would change dependent upon whether we do the injury prevention at the beginning or the end. So again, we just focused on hamstrings for the sake of this study, and this actually looks quite a complicated graph, but I'll walk you through it. Essentially, we had I'm trying to remember how many players, about 60 players we had, and we randomised them into 3 different groups within their teams. And the 3 groups, one was what we call a control group in science, so we didn't change anything for those guys. They just trained as normal. We actually told them to do some core stability exercises that we said would improve their hamstring function, knowing full well that it wouldn't, but they thought they were part of the trial. Then we had a group who did their Nordic hamstring exercises before training, twice a week for 12 weeks. And they did more repetitions as the study went on. And then we had an after group who would warm up as normal, do their training session, but they would leave their Nordics to the end. And we looked at how the muscle responded. And what these bars are here, so the white bars are when they did the Nordics after training. The grey ones are when they did the Nordics before training, and the very light grey ones are our control group. As you can see, pretty much across the board, you don't see too much changes in the control group, which is what we would expect. What we've got here on the bottom is knee flexion angle, so degrees. So 0 to 15 degrees knee flexion just refers to when we're in that elongated position at the terminal phase of the gait cycle. So the hamstring muscle is extended and it's a bit more vulnerable. It's probably about 112% of its normal resting length, if you like. Now what you see is a good thing about the Nordics is, it doesn't matter whether you put it before or after, they work. So we saw, in terms of the peak strength changes, there was about a 12% increase in the peak eccentric strength, and that didn't matter whether it was before or after, it was 12%. What did differ though is in terms of the angle. So when the muscle was in its most vulnerable position, we actually got better strength gains when they did the Nordics before training. And I'll come back to that and show you why we think that happened a little bit later. Throughout the rest of the range of motion, the general pattern was that actually doing the Nordics after training was better. So we've got some mixed results here, which I'll try and help you interpret. What we did as part of this study is we took an ultrasound of the biceps femoris muscle before and after the training study to see how the muscle architecture changed. And what we've got first here is what we would call muscle thickness. So you've got what we would call the deep and super superficial aponeurosis of the biceps femoris muscle there. And the two red arrows there just show you the thickness of that muscle, or one portion of that muscle. And what you can see here, so we've got different colours now, but we've got the same study. So the red group actually increased their hamstring thickness, not by an awful lot, by about just short of half a centimetre. But that was greater than the other two trials. So we actually saw decreases in the muscle thickness of the players who were in the players who did the Nordics before training and the control group. Now, if you think back to the interference theory, that kind of makes sense, okay? Because by doing the football training after strength training, we're affecting some of the cell signaling cascades that go on that we don't need to worry about so much today, but it dampened the hypertrophic response, so that the increasing in size of the muscle. I'll probably just skip over that one because in the interest of time. The next really key finding was something that we call bicep femoris fascicle length. Now, those of you that follow this literature will know that there's quite a lot of discussion at the moment suggesting that if you've got long muscle fascicles, you are more resistant to injury. So the fascicle is what you can see on the ultrasound picture at the bottom there. You can see the deep and superficial aponeurosis again. And this arrow, what you can see if you look very carefully is you can see the angles of the muscle fascicles. Okay. Now, because of ultrasonography, we can't actually physically measure, especially on the biceps femoris, we can't measure where the fascicle inserts and where it ends, but we can estimate it using geometry. So we've estimated the fascicle length before and after. And what we found was the before group, the guys that did the Nordics before training, just like the FIFA 11 Plus would suggest you do so, they got an increase in fascicle length. But the after group and the control group didn't. So, figure out nothing's happening over here. If you can do anything. Oh, there we go. There we go. It's back on again. So if we go back to the slide that I showed you before in terms of the strength changes, and particularly we focus on that vulnerable range we talked about, as you can see, the before group had a better strength gain. And we put that down to the fascicle length change. So because doing the Nordics before training, we've increased our fascicle length. In that vulnerable position, we'll be able to generate more force, which might be really, really useful for injury, particularly hamstring injury. So, before or after, we still don't know. There are pros and cons to both methods. And so Matt's done this absolutely fabulous study down at Football South Coast, where for the first time we've been able to ask, well, what were the outcomes in terms of injury? We know strength changes, we know muscle changes, but what happens if you deliver the FIFA 11 Plus before and after? So I think Matt, if he hasn't alluded to it already, he will later on today. In 2016, he just monitored over 1,000 players down at Football South Coast, and the injury incidence, as he's probably said, was very, very high, double what we normally have. This last season just gone, he's done the FIFA 11 Plus, and across the whole cohort, so again, another 1,000 players, the incidence has dropped down to 11 per 1,000 hours. So FIFA 11 works, we know that already, that's not novel. What is novel about Matt's study is that for the first time he split the injury prevention program into two different groups. One did the FIFA 11 before training, twice a week over the course of a full season. Now in these guys, the incidence rate was about 9 per 1,000 hours. Now I should point out, this data we put together collated at about 75% of the way through the season, so he's still finishing off the statistics for this. We haven't got the exact numbers, but this is some preliminary findings. The second group, what we did is we put part 1 and part 3 of the FIFA 11 Plus before training. So for those of you that are not familiar, part 1 of FIFA is running, pretty much. Dynamic running, different directions, like any normal warm-up, just without a ball. And part 3 is very similar again. okay, a bit more high intensity, but essentially it's just warming up the muscle. There isn't really an injury prevention component to parts 1 and 3. The injury prevention component comes in part 2, where we do things like the Nordic hamstring exercises, we do lunges, we do a range of other injury prevention exercises in terms of strength and plyometry. So the other half of the cohort did part B at the end of training. And this is the result that we got. So I can't tell you whether this is meaningful or significant or not, but in terms of the incidence rate, still improved versus the control season, the season before, but probably about 3 injuries per 1,000 hours more when they did injury prevention at the end of training. So not for the first time in my academic career, I keep proving myself wrong. The caveat to that we don't know about yet, and what we're going to unpick over the next few months, is there a compliance issue yet? So at this stage, we didn't know what the compliance ratings were for the guys that did it before or after training. We'll find that out in the next few months, hopefully. So before and after training, we know that we get a different muscle adaptation. And so I guess my take-home message at the minute would be maybe split it up if you can. Okay, there are some good adaptations to doing the exercises when the athlete is fresh, but equally, we know most injuries occur when the players are fatigued, and we need to prepare them for that. Obviously, it would depend on your schedule, both within the week and also the load of your training session. Okay, is it a heavy training session? It's going to make them more fatigued. Does that impact how you then conduct your injury prevention program? But the last one, which I think is the real key thing, is the compliance issue. Hence the player lying down while all his teammates are doing the exercises. And so we've got some conflicting data so far, and we're not sure whether players prefer it before and after. We're getting very mixed messages, so we've got a lot more to work to do in that sense there. And then just to finish off, we've done a couple of studies looking at, one study in particular looking at when in the training week. On that study, we did some injury prevention exercises either the day after the match or 3 days after the match, in the middle of the microcycle. Now, Rob's probably going to tell you in the next talk that you should do it after the players have recovered. But what we showed in this study was if we did eccentric injury prevention programs in the middle of the week, what happened was our muscle damage, as you can see in the black bars here, was quite high in the day before the next game. Okay, as was on the next slide. Sorry, I'm having to get through these in the interest of time. Our hamstring soreness was also a lot higher when you do those injury prevention exercises at the middle of the week. Now, obviously, if you're doing damaging eccentric exercises that we know are good for injury prevention, there is a time course there when the muscle needs to recover. We need to give it enough time to recover. Some people might think, well, why would you deliver damaging eccentric exercises the day after the game? We're supposed to be recovering the players. But in the teams, or one of the teams that we work with on this study, when you're playing 68 matches in this season, I think, when we conducted this study, and you're playing every 2 to 3 days, if you plan to put your injury prevention in the middle of the training week, it doesn't happen. There isn't a middle of the training week because you've got another game. So during those congested fixture periods, you probably need to shift it back, and perhaps even put it on day one after the game. And there are a number of professional teams in Europe doing this now, and just straight after the game or the day after the game, doing these exercises at that point to allow them to recover at the end of the match. Okay, in terms of the take home, it depends on your context, your training load, your group, how compliant they are. But do have a think about when you schedule your injury prevention. And you can tailor it depending on the stage of the season, how fresh the athletes are. But do think about injury prevention when the players are tired. And also think about that in terms of, if you've got a congested fixture period, okay, you can do it after the game, and it seems to be tolerable, but we do have some more studies to do on that to see whether there are any long-term effects. Okay, just thank you to all the collaborators and the organisers that helped us with those studies. And moving on, lastly,